was suffering from a severe stroke. Although it was nearly impossible for him to recover, I couldn't help but ponder all the treatments to help him do so. As I attended one of my ukulele lessons, my teacher Corey and I got into a very long and mind-changing discussion. Corey was studying to become a music therapist because he too had had a loved one who had suffered from a stroke. What I found most interesting is that as he mentioned his father was no longer able to speak, just as my grandpa, he explained that his father could communicate through music. By singing his favorite blues, his father was able to express a feeling or a need of whatever his heart desired, with each song meaning something else. And Corey, being a musician, could decipher exactly what he meant. It became a magical idea to me, to imagine the impact music therapy can have on the lives of the patients and the therapists who pursue their dreams to become. In short, music therapy is the practice of different musical techniques to help patients with mental health needs or developmental and learning disabilities. One of the main benefits of music therapy is that it is all natural and it doesn't risk the harsh side effects of other highly addictive drugs. But there are several health advantages music therapy can have on our body as well. This includes better brainwave activity, increasing our creativity and optimism, but it also includes a decrease in our blood pressure, breathing, and heart rate. However, in general, its most valuable effect is to put us in a positive state of mind. Because music therapy is such a simple yet beneficial form of treatment, it is also very versatile and can be used for many different cases. It can help regain cognitive abilities from those who suffer from a stroke, improve the speech of those suffering from autism, and reduce the damaging effects of Parkinson's, Alzheimer's, and cancer. More plainly, it can reduce the stress of our everyday lives. One recent example of this is the recovery of U.S. Representative Gabrielle Giffords. Shot in the head almost a year ago, she has regained her voice and what witnesses say, her smile. Through music therapy, she is able to talk and walk once again. Her speech started slowly, though. For example, she would sing Happy Birthday over and over again, until finally she could clearly pronounce you without a singing song. One way to understand how this might work is to imagine that someone has asked you to speak the lyrics of a song you haven't heard in 10 years. You probably can't do it, but if that song suddenly came on the radio, you'd be likely to belch out every word. Music therapy is similar to that idea. It can be performed in several places, including health and educational facilities. First, the music therapist takes into account the patient's condition, abilities, goals, and interests. Then, the therapist decides whether to use the creative process or the receptive process. With the creative process, the therapist will work with the client to create and produce music. This may mean playing an instrument like the drums or writing a song. If the receptive process is used, the therapist works with the client to express feelings or thoughts provoked by the tunes they are listening to. However, we should remember that whether the creative or the receptive process is being used, the patient does not need to be a musician. They need no previous musical talent or background, though it does help if they have an interest in music. In fact, the music therapist will often adjust the music they're listening to something the client prefers. So whether you're recovering from a traumatic injury, developing your speech, coping with the loss of a loved one, or curing the anxiety that comes in any day, music therapy can be a possible fix for anyone. And the possibilities are endless. Maybe it will only relieve the stress of it all, or maybe it will teach you to walk and talk once again. Whatever it is that makes that neurological connection between music and our thoughts, I think it's a magical, inexplicable thing. Bob Marley once said, "One good thing about music is when it hits you, you feel no pain." When I visit my grandpa, regardless of the state he's in, I know this is true. Speechless or not, he can belt his polka music like it were 60 years sooner.